Hi, my name is Judy McIntyre, and I'm an endodontist. My expert tip is proper patient expectations. So, as an endodontist, I love what I do. I'm passionate about saving teeth. And unfortunately, it took me a really long time to realize that patients don't actually feel the same way. So, what my goal is for every patient is to realize that by doing a good job, I can save their teeth. However, what I didn't realize up until actually pretty recently in my career was that when patients actually come to see me, what they want to hear is that they don't need a root canal. And all the writing could be on the wall. They could have swelling, they could have a sinus tract, they could even be severely symptomatic and losing sleep. And they'll convince me in the chair that their pain isn't that bad, and sometimes even trying to convince themselves. But the truth of the matter remains that they do need a root canal. What I want to say is, mainly to general dentists, to have these conversations in your chair before they get sent over. I feel that when they have more knowledge from their general dentist, in their dental home, with the hygienists that they trust, the staff that they trust, they receive my information a little bit better. Also, sometimes I feel like it's good, introduce them to the endodontist that you're referring to's website or any specialist's website, have them do their own research so that they're properly empowered and have proper patient expectations. So to review, I'd like to give you one scenario. It was the holidays. I had a patient, one of my best referring dentists sent over. The story that I got, it was 3 p.m. on the second business day before we were to close for the holidays, around the winter holidays, Christmas and Hanukkah, right? 3 p.m. When patients usually get referred at 3 p.m., they're emergencies. As an endodontist, I expect to work on them. I'm ready to go. We're all set up. We're fired away. We're going to save this tooth. However, what my front desk knew was that this patient had no intentions of getting root canal. She was even a little bit swollen, but her son was visiting from across the country. What she wanted was to ensure that she was going to have a good, pain-free holiday. So she did not want to jeopardize with any risk of my starting treatment. You can imagine what ensued. I'm ready to go. I have anesthesia in my hand. I'm passionate about making this the best endodontic experience ever. But what ended up happening was, due to patients' different expectations, and because the front didn't communicate with us in the back, the patient ended up quite unhappy because she didn't want a root canal, and we were more than happy to give her one, or provide at least a start to her relief. So today's conversation is really about the communication between offices, as well as the communication from getting that important information from the patient, as well as once your administrative team has that proper information to also relay in the back. So a few things obviously set me up in this case for the hiccups, because I had all my preconceived notions as an endodontist. The patient was in pain. I wanted to relieve her pain. They had a full set of benefits. Most patients are clamoring at the end of the year to use their benefits. So all of these factors tainted my perception. And instead of helping her with a root canal, she just wanted to be assured and schedule later for the root canal. This really opened my eyes to the importance of communication with patients in your office, between offices, and listening to the patient and making sure that what you're offering is exactly what they're seeking. And once you hear that, and once you're on the same page, conveying that in a very clear manner to the patient. So it took me a long time to realize that along my journey, and I hope it's received well by you guys. Thank you so much.